Our next panel is made up of fellows and students of the African Leadership Center at King's College London. And they are presenting aspects of their MSc dissertations, which look at societal mobilization and leadership in response to COVID-19. On this panel, we have Alexandra Lukamba, who is giving us an insight into some of these issues in the Democratic Republic of the Congo. And Alex is speaking to us from there. We also have Ivy Wahito, who will be giving us perspectives from Kenya. We have Leonie Mills giving us perspectives from Ghana, and I believe Leonie is currently in Ghana. And we have Ibrahim Machina, who is giving us perspectives from Kano State in Nigeria. So I welcome you panelists. And again, I hand over to Prof. Prof, would you like to just give us a few remarks as we move into this aspect? Again, we have just under an hour remaining. And as you listen, please do feel free to begin to put your questions into the chat, and we will put them to the panelists to respond. Thank you very much. Prof, over to you.
Thank you very much. Again, I would give a much more shortened set of remarks to this panel because, as Shuvai has clearly said, we can see the threads from the last panel really connecting to this panel. The point that the issues on mutuality that Alexandra is going to discuss were issues that I think Moses has already touched on. Ivy is also going to touch on the issue of mutuality and power. And I look very much, we all look very much to listening to Leonie's and Ibrahim's presentation on securitization and the social approach to the crisis. I think the issue of securitization is particularly important, as Moses said. One of the responses that we have seen from several African states is the mobilization in some cases of not only the police, but also sometimes the military to enforce COVID-19 pronouncements or COVID-19 guidelines. And Ibrahim, again, in addition to your protest, Nigeria is now in a situation which is clearly unprecedented in terms of really what is a citizen's uprising and response to the state, although the immediate point of friction seems to be around SARS. And there are people who look at the protest against SARS and says, is this a protest against SARS-CoV-19 or is it something else? But we clearly know that the protest against SARS, that is the security, the special security forces, it's only a wedge point. Some of what's going on clearly reflects the consequences of some of the measures that were taken in Nigeria in response to COVID-19, but also, I mean, the crisis of state and governance that all of you are going to touch on. Once more, a reminder, 5 to 6 minutes for everyone. I would remind you when you have a minute left through the chat box privately, and please try to round up so that we would have enough time to respond during the Q&A. As you've seen from the last panel, please try to be very concise in your response so that you can, we can have at least 2 rounds of questions. So let's turn to the panelists now. We'll start with Alexandra, Ivy, Leonie, and then Ibrahim. Ivy.
Good afternoon, everyone. So I'm Alexandra, and I will be speaking on the research that I did for my dissertation, which is the DRC government's response to both Ebola and COVID-19 outbreaks and mutuality in the transfer of information to the public. So before I start, I want to just give a quick background on mutuality. I'm not going to go into depth, just so we are on the same page. So mutuality in leadership is more so the junction between the leader and the follower. And therefore, to measure the degree of relationship, there is a need to observe the level of mutuality between the leader and the follower. So um, the scholar that I've used to in the subject of mutuality is Michael Cornell, and he focuses on two specific types of mutuality, which is ownership and buy-in. So buy-in mutuality, simply explained, is um, the leader has to put in more effort in explaining to the follower a project to take on board. So, and for ownership mutuality, the follower is directly on board with the project without having extra effort into convincing the follower. Both of both types of mutuality are valid, so there is not one that is better than the other. It is simply to understand the relationship between the leader and the follower. So in the context of DRC is known to have been home to different pandemics and or health outbreaks, or even uh, different difficulties. So there's that. So the arrival of COVID-19 was was not a surprise, or was known to be tackled in a certain way because the country has some type of experience with a health crisis. In the case of Ebola, Ebola is a disease that has come from the Democratic Republic of Congo, from the northwestern parts, the Equateur province. So it has been seen as a home disease and has been tackled that way. Whereas COVID-19, which is a disease coming from outside of the country, coming first in the capital city with a population of 14 million, compared to Ebola, who is in a region with a population of about 1.6 million. We could clearly see the difference between the two on that aspect. So when we look at the relations with the government, it has been quite a rocky relationship with the population. There is a lack of trust with the government because of previous issues. So when we look at COVID-19 and Ebola, we see the rise of new leaders, new social leaders coming from the population itself. So for Ebola, we see that the population, the leader that have emerged were social leaders. So going door to door, spreading correct information to the population rather than just listening to government information. Whereas COVID-19, it was a bit different because of the nature, the context of the city of Kinshasa. There was a need to a method that would work and directly speak to the Kinois, so the population of Kinshasa. So the leaders that have emerged are entertainment leaders and mainly musicians that have used their tool to spread correct information to the population. There's more a connection between the musician and the population, because they are seen as part of the population and not just an elite that sends information and do not interact. So therefore, music was a key element in the transfer of information to the population in Kinshasa during COVID-19. Uh, to conclude, we can see that mutuality plays a key role in the transfer of information, especially during health crisis or any type of crisis, because as I mentioned in the beginning, buy-in and ownership mutuality allows to save some time to the leader to share the information. So we could see with Ebola, the population or the community leaders took on the information and directly shared it to the population. So the uh, we could really see ownership mutuality with that. Whereas COVID-19 in Kinshasa was a bit more shaky. So the leaders had to really put in the effort into convincing the population with a buy-in mutuality to share the information of COVID-19. So to conclude, I said that the government, this crisis was able to show us the real relationship that the government has with the population. And it was also a way for the government to see how to work with local leaders into speaking directly to the population to ensure correct information shared to the entire country. Although it was mainly in Kinshasa, this could serve as an example for future crises, whether health crisis or security crisis. Thank you very much.
Thank you, Alexandra. Ivy.
Good afternoon. So my name is Ivy Nyawera, and I will be taking you through a brief presentation on my research on COVID-19 using the leadership concepts of mutuality and power and analysis of non-state actors' influence in mitigating the negative consequences of state response to COVID-19 on adolescent girls in Kenya. So my research has three main actors. This is the Kenyan government, women's rights organizations, and adolescent girls. I use the leadership concepts as mentioned by my colleague Alexandra, Michael Cornell's definition of mutuality, which is basically defined as the intangible elements that connect leadership together based on shared goals. While power is understood by French and Raven as the ability and potential to influence others. So the mobilization efforts by the government of Kenya were largely masculinized and gender blind, and women's rights organizations basically saw this or foresaw this and started lobbying early enough to have a gendered response to the pandemic. And echoing Dr. Oket's conversation yesterday, where she mentioned that personhood and respect to some lives depends on the class and the resources one has. Young women and girls from rural areas and informal settlements in Kenya are obviously fall in the margins and the very periphery, which is where my research focuses on Machakos County and Nairobi County informal settlements. And one of the negative consequences that I focused on is the teenage pregnancies. There were high pregnancies in Machakos County. A children's department report stated that 4,000 girls had been impregnated between March and June. This is a span of 4 months. So one girl is one too many, but to have 4,000, the numbers were actually mind-blowing. And in Nairobi County, data by African Institute for Development Study recorded 11,000 pregnancies. Now, these are cases which came from during the pandemic and at the onset between March and or June or August. And the government response was very inadequate, which then led to the rise of women's rights organization. The government did not accept the influence of women's rights organization to have a gendered response from the very start. And so they had to mobilize on their own through online activism, sanitary towel distributions, because many of these girls, when schools were closed as one of the response to curb the COVID-19 pandemic, some of these girls who stay in school are usually do so because they're sheltered from abusive families. They stay in school to protect them from early marriages, threats of early marriages, sexual violence. And previously in my work, we have found that during school holidays, that is when abuse happens the most. So to bring these girls in enclosed spaces, to impose curfews, it means men are spending more time at home, and it brings ground for sexual violence. And this was the case. My research found that many girls during that period were abused, rape, defilement, this was on the rise. And the government, because of how divorced and the lack of the shared goals I mentioned previously, they were more on attacking the girls as opposed to finding solutions to this shadow pandemic, as women's rights groups called this. And through interviews conducted with women's rights experts, I found that they were organizing by themselves to also counter the emergence of male predators who saw this as an opportunity to lure girls into transactional sexual relations. Because girls, there was a gap between what girls were getting in schools, for example, sanitary towels, some girls access food when they're in school. And so families were burdened by the lack of this, this transition was not timely and it was not well organized. And so girls sought alternatives to provide for themselves and to provide for their families. And so these transactional relations also contributed greatly to these pregnancies that were noted. And women's rights organizations, through donation of foods, donation of sanitary towels, came and bridged this gap, and they were able to mitigate some of these negative consequences. Some organizations also provided a stipend where girls were able to buy internet to access online services. Again, these are responses that the government of Kenya did not put in mind, because rural communities and informal settlements had little or patchy electricity. And so to conclude, my research found that women's rights organizations have a considerable amount of influence in the lives of girls because they are consistent in their intervention and they have transformative approaches. The expert power, as well as their referent power, enables them to assert influence in the lives of girls, and girls are able to see that these are groups who have their interests in mind, and they're supportive and they're transformative in how they support them, compared to, for example, male predators who are very transactional in their approach, and the government who were accusing girls rather than providing solutions to them. Thank you.
Thank you, Ivy. Leonie?
Good morning, good afternoon, good evening, wherever you are. Thank you for giving me this opportunity to share a bit about my research. So I was exploring enacting societal mobilization in response to COVID-19 in Ghana and the United Kingdom through mutuality and securitization. So like my other colleagues, Ivy and Alexandra, I looked and used Michael Cornell's definition of mutuality about the tangible elements that binds leaders and followers together. But I also wanted to look at securitization as the pandemic lends itself to being securitized, securitization being the usage of governments of suspending normal political processes and fast tracking either resources or military to deal with what they think is the threat to their stability. I posited that the outcomes of this crisis would be likely to disrupt mainstream discourse that usually aligns industrialized economies with being effective leaders without interrogating the fundamental relationships between the leaders and followers. As this is looking and focusing on Africa, I'll be focusing more on the Ghana part of my research, which showed that the Ghanaian president at the time was very quick and swift in his decision-making about enacting the two main forms of societal mobilization, which I explored, which was lockdown and mask wearing. So lockdown was a form of mobilization that was utilized, we saw in many countries across the world. However, there was lots of praise and positivity within African countries that quickly implemented lockdown, even without either having their first cases or their first 10, 20 cases, unlike in comparison to the Western countries who waited until they had a considerable amount of cases before they actually did explore lockdown. And this kind of built mutuality, the ways in which it was implemented. In the UK, there wasn't a consistent messaging, and that's what caused disruption. Whereas in Ghana, it was very clear. It was around 1 week after the first case had been announced, and then lockdown was implemented. However, it must be said that in Ghana, lockdown actually only lasted 3 weeks, and it was only in the 3 main cities. And this is because they realized that even though in theory, it seemed like the best thing to do. In practicality, it wasn't sustainable for the poorer people. Ghana does not have the infrastructure, the digitization, or nor did it have the resources to actually attend and fend for all of those people who were going to be adversely affected by lockdown. And research was coming out and showing that more people would be likely to die of hunger than to be dying of COVID-19. So after 3 weeks, the full lockdown was then lifted. The ways in which I was measuring and looking at securitization was through speech acts. And this is another tenet or a facet of securitization, that it is not just implemented, but the leader or the agent has to actually convince their audience that they have to accept the securitization. And both in the UK and Ghana, the leaders used speeches as a way of not only informing people of what is happening, but trying to convince their followers to adhere to the protocols that were being put in place. Assessing and looking at these speech acts, in the UK, it was clear that they relied heavily on securitization language. So this was referencing World War II. This was referencing the COVID-19 as an enemy, talking about how we are fighting an invisible war. Whereas in Ghana, there was a lot more usage of community-based language, leaning on the fact that we care about our elders, adding parts of the things that we have to be proud of in the country, especially our food. So they were talking about, if you have these specific foods, this has the right nutrients that will combat COVID-19. So all of these elements of leaning on cultural signifiers, markers, leveraging community-based groups that are important to us, such as the church and other religious institutions, made it seem as though, even though they were trying to display a sense of urgency, they were trying to build mutuality. Whereas in the UK, they were focusing on securitization as a way of building that sense of urgency. However, what was found is that securitization only seems to be useful for short periods of time. And as the pandemic stretched and it extended longer than lots of people realized, when it came to adhering to these protocols, lots of people lost interest and more people decided against actually following the protocols that the leaders had put in place. Secondly, the other mobilization I looked at was mask wearing. Now, interestingly enough, in Ghana, the president made it very clear that it is mandatory in all public places, work, shops, religious institutions. Masks are mandatory, and there was harsh consequences if they were not adhered to. And pretty much, the only pushback was about the economic implications of people not being able to afford masks. It wasn't really politicized in that it's our right not to wear a mask. Whereas in the UK, we saw heavy political demonstrations about how it was against human rights in order to force people to wear a mask. So once again, showing the differences in how the approach of the leaders to inform their followers of the importance of this mobilization, how the followers actually reacted to it. And lastly, I would just talk about some of the negative aspects that happened in both contexts very quickly, that kind of put a dent in either their securitization or their mutuality building. In Ghana, one MP was found flouting COVID restrictions. He had tested positive and then still went out to do political campaigning. Now, as it is an election year in Ghana, this worried a lot of the political elites because they realized that they couldn't do their usual normal activities. So what was found is that a lot of the speeches, while they were used to build mutuality, inform people, and enact societal mobilization, there was a lot of political campaigning in there because political rallies had been suspended. And this was kind of the only way that the president could convey and get across his messaging for the election that's coming up in December. Similarly, in the UK, while it was an election year, Boris Johnson had just been elected. So now he was trying to use this time and using his speeches to try and convey that he was a good leader and trying to introduce himself as a suitable and strong leader to handle this pandemic. Now, whether or not the people agree with they are good leaders or bad leaders, what can be seen is their effectiveness. And in Ghana, the cases have been relatively low. People have been following the protocols to a large extent, whereas in the UK, the political disconnect and the political infighting has very much hindered the progress for COVID-19, and that's why there is a resurgence. So to conclude, I found that a combination of securitization to display that sense of urgency, but also building mutuality and also to sustain the societal mobilization is what works best in combating the pandemic of COVID-19. Thank you.
Thank you, Ibrahim.
Thank you, Professor Rashid. Hi, everyone. My name is Ibrahim, and it's a pleasure to present some of the findings of my dissertation. My dissertation is I look at the leadership approaches to societal mobilization in response to COVID-19 in Kano State in Nigeria. Kano State is the second largest city in Nigeria and the second most populous city, and also the commercial hub of northern Nigeria. I use the leadership as a process analytical framework, and I frame leaders as those who are most influential in mobilizing society to respond to COVID. This enabled me to study both assigned leaders and emergent leaders in response to COVID-19 in Kano State. I will start by the response by the state government. Of course, we know that the state government has the formal authority to respond, and they use mostly top-down routine management approaches to respond to a complex crisis which require leadership, because we know that the threat of the pandemic enabled leaders to use some measures which ordinarily they could not have used that. For example, the lockdown of the state or encouraging people to stay at home and practice social distancing and personal hygiene. However, response from the citizens cannot be achieved without building mutuality and also a top-down, bottom-up approach to respond to the pandemic. In addition, other factors such as economic hardship that people experience due to the lockdown or stay at home, because most of the society depends on informal economy, are also contributed to people not adhering to these measures to respond to the pandemic. Also, the state-society relationship in the society before the pandemic, there was weak governance and also lack of trust, accountability, and also exclusion of citizens and other societal actors in governance processes also contributed to the inability of the state to mobilize society to respond. As a result, the patterns of citizens' response toward the state mobilization effort was alarming. There was poor community awareness and ignorance of the pandemic in the state. While some citizens embraced the government public measures to stay at home and also practice social distance, a large segment of the society, first of all, some even denied the existence of the virus, while also others were, they believe in the existence of the virus, but they were indifferent. People go about their normal activities. Some even play football tournament, they target Corona tournament. Also, others go to other activities like continue going to mosques, burial activities, all other large gatherings. People continue the activities, and as a result, there was spike in community transmission, which eventually led to a high number of deaths. And also, how government responded to this spike in community transmission and the number of the reported, which they call it a mysterious death. They first of all denied its relation to COVID-19. On the one hand, we are trying to explain the danger of this pandemic to people, while on the other hand, we are denying that these deaths were not even related to pandemic. They failed to build mutuality with the federal government because investigation by the federal government presidential task force on COVID-19 related the deaths to COVID-19, while the state government. So there was a lack of coordination between the federal and the state government in this aspect. So as a result of this citizen response and the high number of deaths recorded in the state, Kano State citizens come together in order to supplement and respond to this pandemic, to mobilize society. As a result, there was the establishment of Kano Against COVID-19, which is a coalition of Kano stakeholders, including community leaders, business leaders, academia, women leaders, and Kano citizens who come together and establish a citizen-led initiative to engage in advocacy and mobilization along the three tiers of government. They engage the federal government on the one hand, they engage the state government, and they also engage the local government at the local level. They also engage private sectors and international development partners in order to address these challenges that I briefly mentioned. Because of lack of time, I cannot mention other key issues, but the main issue is the slow response from the government to respond to this pandemic, which led to a spike in community transmission and also high number of deaths recorded in the state. So this coalition supplemented the government response because there was even low testing rates in the state. People, because of stigmatization, people just relate that whenever you are tested positive, then it's more like a death sentence to you, which also led to a spike in community transmission. So they first of all facilitated the rapid expansion of the state testing capacity by establishing additional well-equipped testing centers, mobile testing laboratory, isolation centers, and personal protective equipment. On the one hand, that is to supplement the testing capacity. Also to reduce community transmission, they engage in advocacy and mobilization at the local level. They engage traditional and religious leaders who are respected by the local people and who also establish mutuality with people even before the pandemic. They sensitize public to encourage people to go and test, to practice social distancing and also personal hygiene, and also to go for tests so that you should know your status and also to take the necessary measures, which was also which they succeeded because there was a rapid expansion of the testing capacity of the state, and also the testing more testing samples were collected. And this was achieved because people accepted the influence of these local leaders who they respected and trusted. Also, they encourage religious leaders to suspend religious activities such as praying in congregation and also going to mass gathering like burials and other activities in order to contain the spread of the pandemic. They also launched a pilot mass community testing in collaboration with the state government to encourage people to go for more testing, and also this was achieved with the help of traditional and community leaders. However, the state government failed to expand this mass community testing scheme to other local governments areas and other communities. They also developed technology to address this pandemic by amplifying narratives on social media to engage community through sensitization and awareness campaign. And also they set up COVID-19 call center facilities so that people can call and get information, because most of these call center established by the Nigeria Center for Disease Control were very, some of them are not even responding. You can call the numbers and it will not go through. They also develop self-testing application that people can use to, based on the system you develop, so that you can understand whether you are exposed to this pandemic or not. So these are some of the measures engaged by this community citizen-led initiative in order to supplement the state government response capability. And also, so some of the major findings that this study tells us is that bottom-up approach to the complex situation like COVID-19 is very important, because by engaging other community actors, government will find it easy to mobilize the society to respond, unlike top-down approaches whereby government are just issuing directives to the citizens, and it's very difficult to build mutuality and support for the citizens. Thank you very much.
Thank you very much, Ibrahim.
Thank you. Thank you very much to all the presenters. I think this is very fascinating, and thank you for taking us through that partial tour across the continent. So we're going into our question and answer segment now. We have a couple of questions in the question and answer box. I will just refer to the first question and pose this to both Alex and to Ivy. And also link it to some of what you've already told us this today. So Femi, and thank you for your question, Femi. Femi says that a big challenge that he has observed across the continent is the inadequacy of integration between academia and policy formulation of governments. And his question is how this can be bridged. To you, Alex, bearing in mind Femi's question, how would you leverage the role of musicians, as you have pointed out, and the mutuality they've been able to leverage by non-state actors in this interaction between academia and policy formulation for government? To you, Ivy, again, bearing in mind Femi's question about academia and policy formulation, in the example that you shared with us, and you talked about women's rights organizations having influence in the lives of girls, how would you leverage this, this kind of influence that they have, especially where there seems to have been a time lag in the Kenyan question? So where we did have these huge number of pregnancies that occurred, how could this influence that women's rights organizations have and their ability to establish mutuality be leveraged? So Prof, I'll leave it at that, and perhaps you have questions for Ibrahim and Leonie.
Okay, so again, I'm going to follow your cue, Shuvai. There's a question from an anonymous attendee that I'm going to read out and pose to the panelists. And the question is, what are the panelists' thoughts on political leaders holding campaign, predominantly in Africa, with most showing little regards for the guidelines put in place amidst of a pandemic? What does it say about governance in your opinions? I would just add two more short and precise questions to the panelists, especially Ibrahim and Leonie. Leonie, I was very struck by your discussion of the messaging in Ghana and the United Kingdom were different insofar as securitization was concerned. And it made me think about the debate between human and hard security. So would you say, in the case of Ghana, that the conception of securitization or the conception of security, especially in relationship to public health, was much more closer to the spectrum of human security being thought of as human security, that is people at the center of how we think about security, rather than the case of hard security that was used in the United Kingdom. The second question, much more specifically to Ibrahim. Ibrahim, one of the things that was very striking when one was following the discussion about COVID in Nigeria and the response to COVID was to hear some senators and some politicians in Ghana really questioning the nature of COVID and its mortality and impact on the population. I think one of the Kano senators, or a senator from northern Nigeria, simply just said that, look, why are we talking about COVID? There are other things that are going on that have greater, social and economic impact on people's lives. We have other diseases that are taking a heavier toll on people than COVID. What would you say in terms of the the nature or the role of that initial leadership response and how it affected people's responses to COVID before, as you said, I mean, people became much more responsive to the messages. Again, so what do you think about those initial political signals that were coming, especially from some of the northern politicians vis-a-vis COVID messaging?
So I'm going to start answering the question. I think the second question that was asked in the Q&A box kind of goes into the question that asking me. So the question about the role of the political leaders and how they are not respecting the rules that have been put in place. So it kind of explains why the population has a problem in trusting the government, because the rules come from the government, but political leaders who are members of the government themselves are not respecting these rules. So it's hard for then the population to believe in either the reality of in the existence of the pandemic, or just in the trust that the rules put up will actually help the population in fighting the pandemic. That is leaving an important gap for the emergence of new leaders, like I mentioned, the musician, because they are actually part of the population, working with the population to find a solution that would match what the population needs. So the musician, I would say, use their power, which is speaking the same language as the population, to speak to them in a manner that they would understand, and not just speaking to them and telling them to do things that they would themselves not follow. So yeah.
Thank you, Alexandra. Ivy. Ivy.
Hello, can you hear me?
Yes, I can hear you now, Ivy.
Okay, so on the question about bridging the gap, I think I will also draw on the lecture from yesterday by Dr. Okech about the work that we must do at the grassroots and movement building. This is work that is already being done by many women's rights organizations and women's rights experts. So it's to recognize that that grassroots work that these organizations do is critical in knowledge production, because it comes from research and lived experiences of young women and girls, which counts as legitimate knowledge and could be used in policy formulation, in curriculum formulation in the academia space, and to also see these organizations as partners. They're usually seen as pushing the donor agenda. And I always say, if the donor agenda is to see girls educated, shouldn't that be the government's agenda? So it should be everybody's agenda. So it's to invest in the work they're doing, to see them as partners, and to recognize that work done at the grassroots counts as legitimate knowledge production and legitimate work that could be used back in the academia space and the policy formulation space. Thank you.
Thank you, Ivy. Leonie?
So on the question about the political leaders and the campaigning, as I said, in Ghana, it's currently an election year. So my research was looking at the months of March to July. So that meant that a lot of the things that were currently happening didn't happen in that period, because it was sort of the peak of the pandemic. But after that, what we have seen is that the government have been loosening restrictions to coincide with rallies and conferences and political campaigning that they wish to do. So if I had been able to look at a longer period of time, we probably would have seen like what we did see was another breaking of mutuality, in that there's one rule for the political elite and then there's another rule for the people, that if the people say, you know, they want to hold a conference or they want to go back to church, they said no. But then when they were coming to launch the African Continental Free Trade Agreement, the day before, they suddenly announced that, okay, now we can have conferences of up to 200 people following social distancing measures. So it does show that disconnect, but I think that from the people side of things, they've gotten quite used to having one rule for the elites and one rule for the people. So it didn't or doesn't cause as much dissent as people may have assumed it has. And on your question about human security, I think that it was they did use human security elements. So, you know, looking at development and well-being and welfare and placing humans at the center. But that wasn't quite what was portrayed in the speeches. There wasn't that focus on, he didn't say it, but the actions kind of portrayed it. So when they lifted lockdown, it was because, you know, they couldn't literally take care of the people. But in the speeches, he said that, you know what, we've had some progress and actually we're doing well. So we no longer need lockdown. So there was this kind of disconnect with the reasons why people assumed they were doing something and the reasons what the president was giving. He was basically saying that it was positive, that we were doing well, even though the numbers were continuing to rise. But people felt it was because they couldn't provide water, they couldn't provide electricity, they couldn't provide all of the things the government had committed to provide during lockdown.
Thank you very much, Leonie. Ibrahim?
Yes, thank you for the question. I think that statement has been shared by many in northern Nigeria and Kano in particular. Many people are also have raised the same concern that, okay, we are facing other challenges. There is insecurity, there are other diseases which has also high mortality, which has a high mortality rate than COVID. So why are we talking about COVID? I think this has to do with the uncoordinated response of the pandemic by those in position of authority, which shows that they have not mobilized and shared their vision of responding to this pandemic to the people. Despite the fact that, and also which shows the weakness of our public health system in the country and in Africa at large, because other diseases which has non-cure, non-vaccine, we are not able to address it. Because of a pandemic that so far has no non-vaccine, only measures to prevent it. I think this thought has been shared by other people because they expressed that in the course of my interview. So I think coming from the elite, those like the senators, I think has also weakened their response, because this has shown to the people that this is not something we should take it serious. And as I mentioned to you, there was indifference for a large segment of society in the north. So statement, this type of narrative, instead of the government to bring people together, those in position of authority to bring their followers and their constituency to respond, because although other diseases were killing people, that doesn't mean we should not take this serious, because this is something that is very live. People are dying, people are, you know, in hospital. So I think this type of statement is one of the uncoordinated response that is weakening the government. So they are just like contradicting their statement. On the one hand, they will tell people to respond, while on the other hand, they will release statement that is also contradictory to what they are saying. So that is what I think.
Yeah. Thank you, Ibrahim. We have one last question, which is from the Q&A box. And I'm going to read and through this question to all of the panelists to respond to within a minute. I'm going to add another question so you can answer Martha's question. Thank you very much, Martha, for your question, or the other question that I'm going to throw to you, the panelists. So Martha's question is, have any of the governments of the countries discussed made any efforts towards mitigating the negative impact of the pandemic on their economies? The final question I think that I want to throw to you is, looking at the relationship between leaders and citizens in the various countries that you have all talked about. Is there anything that you see that is innovative or that is different or that is useful for the issue of mutuality between leaders and citizens in your studies? So everybody has a minute. We're doing very well for time. So this is the roundup. And once the panelists have responded, Professor Shuvai would round up and take us home. Thank you very much. A minute each. And we will start from Ibrahim, then go to Leonie, and up the list. So, Ibrahim?
Well, I think this coalition that I mentioned, the emergence of citizen-led initiative, to me is very innovative, because this is something that was necessitated by this threat of this pandemic, whereby citizens come together irrespective of political differences, irrespective of their diversity, come together to supplement the government because of its weakness in its response, to engage the community, to engage private sector, to engage community leaders, engage regional leaders, women group, youth, in order to come together and mobilize society to respond to a threat that is, devastating the economy and also devastating human lives and social activity in the society, which also shows the importance of building mutuality between the people and government in order to respond not only to COVID-19 and other societal challenges that we are facing in our community.
Thank you, Ibrahim. Leonie?
So in regard to the economic impacts, I think that the main thing that Ghana has done was to continue to launch the African Continental Free Trade Agreement, in the hopes that people are looking more towards international continental trade rather than trade outside of the continent, and hoping that by working with each other, they'll be able to reduce the money that they spend on importing. And in terms of being innovative, I think the thing that I would say was the most innovative was the quickness in which the government were able to pivot from different forms of mobilization. Some of the things that I didn't speak about, but I'll just mention quickly, is that the government offered 50% free electricity for its citizens, hoping that because they realized that we're going to need to rely more on digitization. Now, this didn't help those who don't have electricity, but for those who do, it was something. And also they committed to providing free water as well, which was very necessary considering how much this pandemic has shown us that health and cleanliness is central to its So I think those are the two main innovative things that I've seen that the government has been able to implement.
Thank you, Leonie. Ivy?
I think for Kenya, and I'll speak on the issue of violence against women, we saw that in one particular county, the government there opened a shelter for women experiencing violence. And I think given the heat of the issue at the moment, they were very quick to do that. And because it's a government-run shelter, the government is sort of piggybacking on that one shelter in the county and using it to parade the issue that it's working towards opening more shelters within the country. I wouldn't say that there have been mind-blowing innovations out there, not that I can think of at the moment.
Thank you very much, Ivy. And Alexandra?
I would say that the most innovative thing that the government has done, I would also, what Leonie has previously said, is that the government gave, I think, 3 months of free electricity bills and free water, and provided water for areas that were not able to have access to water here in the capital city of Kinshasa. Another element I would say is also that the country was able to look inward, because most of usually in times of crisis, the first thing to do is to look outward into Western countries. But since we had to face ourselves, we looked inward and found local solutions to the problem that we were facing. Thank you.
Thank you to all of the panelists for your excellent contributions and for making this, as Dr. Ekpe said on the Q&A, a very rich conversation full of thoughtful, relevant research, not only for the continent, but for the world of global relevance. So let me turn over to my co-chair to round this up and take us off. So.
Thank you so very much, Prof. Rashid, and thank you to our spectacular set of panelists. Thank you for your very enlightening, thought-provoking, informative, educational presentations. Thank you for taking us on a tour across the continent, but also across the seas to China. I would like to really thank you, Chimwemwe, Adeoti, Leonie, Moses, Hubert, Alexandra, Ivy, Ibrahim, for your thoughts today. Thank you to all the attendees for your questions as well and your interaction. It has really been a very, very rich 2 hours we've spent together. Thank you also to James, who's been assisting us on the technical side. Finally, thank you so much, Professor Rashid, for agreeing to be with us today and for all your input as well as your guidance. I'd like to remind you all that we are still in the midst of King's Africa Week. There are still many, many more exciting conversations, dialogues, presentations, lectures that are taking place. There's something on mental health. There's something on the arts in Sierra Leone. There's something on linking global Blackness to gangs and to street culture. So please make sure to look out and check out all of it. On Friday, we end off with a panel on security sector reform and Nigeria, and looking also a little bit more closely at the NSARS movement. So thank you very much to everyone, and we hope to see you later in other conversations. Thank you and goodbye.